Over the last 24 hours, we have identified 331 new cases of COVID-19 and completed about 9,500 tests. That puts our positivity rate at about 3.6%. There are currently active alerts or outbreaks in 230 schools, or about 10% of the schools in the province. Currently, these schools have a combined total of 895 cases since January 11th. We have identified 33 new cases of the variant of concern, bringing our total to 541. There are 245 people in hospital, including 47 in the ICU. Sadly, I must announce that 9 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family, friends, and loved ones of people who have passed away. Today's announcement about expanding our immunization campaign is great news for our province. Within the next 4 months, all Albertans who want to be vaccinated will receive their first dose, and by this fall, they will be protected with 2 doses. This will make a world of difference in our ongoing battle with COVID-19. I know there are questions about the efficacy of different vaccines, and people are trying to make sense of all the information out there, whether it's coming from the news, social media, or well-meaning family and friends. Even when looking at leading medical sources, it can be daunting to make sense of some of the scientific research, terminology, and data. As always, my goal as Chief Medical Officer of Health for Alberta is to provide Albertans with the facts, information, and data from an evidence-based medical perspective that they need to inform their decisions and actions. Part of the challenge with the vast amount of information out there about these vaccines is that it can be limiting to compare vaccine statistics like efficacy, because studies are often done at different times and look at different groups of people or groups of different sizes. It's also challenging because evidence on vaccines evolve over time as we continue to get real-world data from countries that are using these vaccines and monitoring their effectiveness. I want to stress that all the vaccines currently approved for use in Canada will reduce the risk of severe outcomes from COVID-19, including hospitalization and death. All 3 have passed the rigorous regulatory approval processes in place to ensure they are safe for all Canadians. And all 3 offer significant levels of protection from the virus. No matter your current age or overall health, I strongly recommend all Albertans are vaccinated against COVID-19 as soon as they are eligible. All 3 vaccines help protect against serious outcomes or long-term health impacts that COVID-19 can cause for many people. They dramatically reduce the risk of hospitalization and death. And if those reasons don't resonate with you, please know widespread immunization will help us all return to a more normal way of life more quickly. Choosing to be immunized is one of the most important actions we can take for ourselves and for our communities. Finally, I want to take a moment to acknowledge the milestone we will reach tomorrow. March 5th marks 1 year since we identified the first case of COVID-19 in the province. Together, we've navigated the uncertainty of COVID-19 and living in a global pandemic. We've had to find new ways to work, socialize, and look after our health, all while researchers, scientists, and health professionals from around the world have worked to learn as much as they could about this new virus and how best to treat and prevent it. Despite the changes, challenges, and losses we have encountered, we have proven just how resilient Albertans are. Our fight isn't over with COVID-19 because it is still very much in our communities. But we are so much closer to returning to a more normal way of life than we were a year ago or even a few weeks back. We are in a very different place than we were in 1 year ago. We know much more about how the virus spreads, we have much greater testing and contact tracing capacity, and most importantly, we have several good vaccine options that are bringing us closer to being able to successfully take away COVID-19's ability to spread widely. We've had many different stakeholder groups approach us to ask about the timing of allowing fans or spectators for different types of events. And so we are having conversations with many different stakeholder groups about what kind of timing we anticipate that might be possible in, what the requirements would be if that happens sooner versus later. So again, decisions haven't been made because we have to look at all those different factors. But those, of course, are proposals that are part of the larger group of proposals that we're looking at, recognizing that as more vaccines come on board, and looking forward and planning forward, we need to be ready for being able to do activities safely that we haven't been able to do for a very long time. We prioritized those where we'd seen the greatest impact with respect to severe illness and death, which is long-term care and supportive living, designated supportive living facilities. And so in those locations, we did offer to residents and staff of all of those locations, focusing on that group in January. And then we were planning to roll out in Phase 1B the residents of those other supportive living facilities. But again, given our vaccine constraints, what we wanted to do was offer all Albertans outside of those very highest risk settings the chance to be immunized when they were personally at the highest risk. So anyone, again, 75 and over, and then the residents of those other congregate living facilities. Staff in those other facilities, so again, we're talking about non-designated supportive living, non-long-term care facilities, those staff are eligible coming up in 2A. So again, that's the March 15th start date that you've just heard about. And the, again, planning that we've done on vaccines, we know that there are many, many groups in this province who will benefit from vaccines, but we have to really make careful decisions about how we offer those limited supplies of the early vaccines to be able to protect those most at risk. And we chose, again, in that 1B rollout to focus on those individuals, again, who were 75 and over and those who were living in those facilities with the intent of protecting those individuals with their personal risk at a high level.